how marketing has evolved from just pushing products to creating long-term social impact. Now it's all about campaigns that actually resonate with audiences on a deeper level. In fact, the data tells us that Gen Z consumers are willing to spend so much more on campaigns and brands that actually align with their social and environmental causes, and that millennials are, more than 90% of millennials are willing to donate only if an organization aligns with their missions or causes. Today we have here an amazing panel, a set of leaders who are leading this shift from campaigns to commitment. They are going to share their insights and experiences with us. And without further ado, I'm excited to see where this conversation takes us. So to kickstart, I'm keen to understand, as we see in this fast-changing world, ever-decreasing attention spans, starting a social campaign is difficult, let alone sustaining it. So, Winifred, could you share a story of how, at what point a campaign that you were involved with turned into a commitment, and what was the tipping point?
Sure. Thanks, Harshita. Maybe I'll start by taking a quick pulse check in the room. And ladies and gentlemen, if you have heard of epilepsy, which is the neurological disorder, if you've heard of this word before, can you raise your hand and leave your hand up? Keep it raised. Yeah? Okay. And if any of you think that it is hereditary or it's contagious, you can lower your hand. Yeah, so, okay, that's quite a few hands lowered. And lastly, if any of you are living with epilepsy yourself or know someone who is, lower your hand. Okay, so thank you so much. So, well, this is really what we do and why we do it at Sanofi. We're a biopharma company that works in the space of healthcare. And this tipping point for us came very earlier on, because when we start a campaign, we know it's never going to be just a campaign. It's really a cause that we are advocating for. And similarly for epilepsy now, contrary to what we saw in the room, data shows otherwise. Over 12 to 13 million people in India are living with epilepsy. And not many know of it, or they don't speak about it because of the sheer stigma that surrounds it. So that's really where our journey began in 2021, where we started the Dare to Know Epilepsy campaign. And we thought we should bring in somebody who is really living with this condition, not just acting it out. So we brought Jonty Rhodes on board. Of course, we know India reveres cricket. We have a lot of passion and heart in that game, so we thought it was appropriate. Jonty spoke about living with epilepsy, the challenges he faced or not, the support he got from family and friends, and how he progressed to living a near normal life, which is what it should be as. And then we sort of layered that with doctor voices, because then the doctor community joined us. We know in healthcare, people mostly want to believe the word of the expert, and the doctors really are considered the experts in that area. So we brought in healthcare experts and, of course, translated it into languages, and the conversation started going. Couple of million views. And then we finally sort of layered that particular campaign with a short film, a humble short film, where our protagonist actually lived the day in the life of someone living with epilepsy. So I think that really struck a chord. And virality apart, if any of you, for instance, had to Google love after arranged marriage plus Sanofi, our film will pop up first, got about 25, 28 million views, but that really wasn't what we were chasing. What we were really chasing was what we heard in the comments. People really said, thank you for telling my story, or thank you for helping me tell my mother what I really go through, because they are stigmatized. People don't hire them. People think if you're living with epilepsy, you won't be a suitable marriage partner. Women have it worse. They feel you can't bear children, or if you can, they are not healthy, right? We had a room full of people who have heard about epilepsy, but half of them think it's probably contagious or hereditary. So for us in the healthcare space, really, that starting is always the tipping point, because it's literally a pinch of courage and not a gallon of courage. A pinch of courage it takes to tell the truth. And then we are onward from there. So, yeah.
Amazing. Thanks, Winifred. I'd like to now bring in Varinder. I think from a media perspective and a media for change perspective, how do you approach this?
Thanks. Yeah, that was wonderful. Can you all hear me? Thanks. So I'll take a cue from what you were just saying, Wilfer, because what we do in media is also, kind of challenge some of the norms. What we're doing is, bring out the information which, that sometimes people don't want to talk about, or there is a lot of stigma attached to it, right? Like you were saying. So we've done a lot of campaigns around, changing gender norms, where we've had hashtags like Bigdi Hui Ladki and, kind of changing the narrative on it. We've done, a lot of work at BBC Media Action on condom normalization, which is, a big taboo topic. Nobody wants to talk about, using condoms. And this was something when HIV/AIDS was, a very, very big disease. And south of India was actually in denial. There was a lot of hyper masculinity going around, and the men did not want to use it because they don't think they will get the disease. So, from changing those perspectives, but the one that I want to talk about on the tipping point with that you're asking was when we were doing, work on poo. So, again, sitting here in the metros, we don't talk about shit. We don't talk about, where our shit goes, because we know that there are sewer lines and it's being connected to FSTPs and everything is taken care of. But in small town India, where, more than 70% of the households are sitting on septic tanks, it's very important that they understand where the shit is going and that it's not ending in the lakes and rivers. So, talking about a topic on mainstream media, on drama, which is informing them, entertaining them, and making the impact. It's just very important that sustainability is, something which is what you're starting with. It's not something that builds on, but when you're making a behavior change campaign or a behavior change, built-in drama, it was very important for us to have that in our heads, when we were looking at it. Finally, it was really walking that tightrope of entertainment and the impact is where what made it so sustainable. We came up with the season 2. We came up with a hashtag which said, give a shit about shit. Trying to make it, disruptive and at the same time impactful was the tightrope that we were walking. We worked with e4m and finally reached some 60 million people. I mean, I think that's the power of media, right? The scalability. 60 million people, I think the cost was like 2 rupees to reach that viewer. And then, of course, there was this impact that people were now discussing this, talking about their septic tanks in these small towns where they haven't ever cared about, it's like out of sight, out of mind, you flush and you forget. But there was an independent evaluation done by Gates Foundation. That's the organization that was funding it. But that's what made it sustainable. Everybody coming together from a e4m entertainment industry person to, BBC Media Action for creating that impact, as well as, Gates understanding what we were trying to do. So everyone coming together and understanding that you can't be impactful without being entertaining. And you can't be just entertaining because that's like then, I mean, you can be entertaining, but then, there's like junk content and then there is nutritious content. And that's the conversation that we're now opening up a lot on gender norms as well. So I think just to say the tipping point of sustainability, I think comes when you make it both entertaining and impactful. For sustainability, that's just very, very important.
Amazing. Thanks. Puneet, would you like to add to that from a corporate perspective?
Well, first of all, good afternoon, everyone. And it's really an honor to be part of such an elite panel, such a diverse panel, I would say. At Hyundai, we have always believed in our vision, which is the progress for humanity. Whatever we do under our social impact largely comes under the bucket of earth, mobility, and hope. I'll be talking about all these areas in a little detail, but I think I was very inspired by what Winifred said about the health. And I'd like to start with some of the campaigns which are really close to me personally, to my heart, but also are very meaningful to the society. And I'll take you around 3 years back, when India and the global world got caught up in a global pandemic, which was the COVID. During 2021, what we realized, that whereas people staying in big cities like, say, Mumbai, Delhi, Jaipur, all the big cities, they have good access to healthcare. But let's look at India, which largely is a rural area, and where the people, even for getting a basic medication, have to travel to big cities around 150, 200 kilometers away, which not only adds to loss of their revenue and their money, but also is a big challenge on the carbon footprint. Because, they are either using a public transport or they're coming on their private buses or cars or whatever, which adds to the carbon footprint. So, we thought, why can't we vet technology with medicine and give something to this society which can address both the concerns of these people? And that's where, one of our sustainable and a very strong campaign, I will call it, is the name called Sparsh Sanjeevani. I mean, it's a very apt name. Sparsh means touch and Sanjeevani means, everyone knows it basically brings people to life. So we started off with the pilot clinic in Lakshmangarh district in Rajasthan. That village basically did not have any good doctor, no clinics, not even public health centers. So we started a clinic around 600 square feet, wherein we got a good doctor, a compounder, a lady, a nurse, so that people and the females could come to those clinics. And we took around 25 doctors, I remember, at that point of time, who are on our panel. Most of the doctors from big hospitals like AIMS, from SMS College, Jaipur, and all those doctors were consulting these rural patients through video conferencing. So the patient used to just walk, because maybe half a kilometer from their place, they go to the center, they will meet. If the disease is something which is understood by the local nurse, then he or she will give them the medication and free medicine. But in case if it's a little more serious kind of a disease, then they will connect them to the doctor, who through teleconferencing or video conferencing will see the ailment, give them a prescription, and a free medication will be given from the telemedicine center. Now slowly it became such a brilliant idea that over the last 3 years, we have now gone to 7 states. We have opened more than 35 telemedicine centers. And this year, 15 more telemedicine centers in 3 more states of the country, including J&K, which is a very difficult area, but that's our commitment, will come up. And these 50 centers on an average will be taking care of not less than around 1,000 patients every day, who will be coming, who will be taking free medication. And the best part about these clinics is that they are self-sustainable. So what we are doing is that we are taking a very basic cost, say 50 rupees or 60 rupees from each of these patients, and that cost is being funded into a fund or corpus. So for after 3 years, once the clinic goes through that life of 3 years, it gets that money in the corpus and it becomes self-sustained. So that you don't have, as a Hyundai Motor India Foundation, which is our arm for these CSR activities, we don't keep on funding that clinic, but it becomes a self-sustained clinic. So we further topped up that Spur Sanjeevani program with another thing called the mobile medical unit. Now, a patient still has to travel 1 kilometer to go to that clinic. But now we are putting up some vans in districts of Rajasthan, Haryana, Punjab, Tamil Nadu, Maharashtra, wherein these vans equipped with doctors will go to the rural areas, to those nukkeds and to those corners where the patients can come and they can actually get medicine over there. So, with this, not only we are reducing the carbon footprint, but we're also using a lot of technology. And then one of the good thing about this program is that we are getting a lot of database now. So today in Rajasthan, I know that maybe dermatologists or diseases related to skin are very common. In places like Haryana, diseases related to, respiration, these kind of diseases are very prevalent. Similarly, in West area, we also have got some very good database of what kind of diseases are there. And these we are now contacting the local centers, local hospitals, and giving them, so that they know that, okay, this area, 70% of the patients are coming with such kind of disease. So a good repertoire of diseases, good collection for the public health centers, and also a lot of reduction in terms of the social value, which we compensate through these telemedicine clinics. So that's one area where I feel, and all our programs are long-term programs.
Yeah.
So that is the commitment which we have, that whatever we do for the society should not be short-lived. It should be long-term, it should be meaningful, it should add to the value of the society, and at the same time should be self-sustainable.
Amazing.
So that's one of the program, but we actually do a lot of programs. We've been working since 2006 as part of our foundation, and definitely, I mean, in the area of environment, in the area of social health care, also in the area of commitment to livelihood by skilling, upskilling, and job enrichment. Those are another areas. And mobility, wherein we are talking about giving back to the society through programs like Samarth, which we have recently introduced. So I think that's where I feel part of our commitment to the society.
Amazing. No, thank you so much, Puneet. That brings a great segue into my next question to Amitabh and Aishwarya. From a founder's perspective, could you talk about how, when you are launching a campaign, do you have a long-term vision, or is it something you stumble upon on the way? And what do you think is that secret sauce to actually convert a campaign into a long-term commitment?
So I guess we align in this. Firstly, thank you so much for having me here, everyone. We align in this that it's always both, right? You start with the long-term vision, and then you always keep a space for being able to evolve with the campaign, the most important aspect in this is having the feedback loops with like the customers, number one, and number two, with the key stakeholders that are there. Always taking the feedback and understanding how we can, if the strategy you have to change it. You have to start small. You start small. If you think that the strategy needs to change, just simply change it. But the point is, having feedbacks in every stage of the campaign is very, very important. That's how we take it.
So, thank you, everyone. So, I would like to talk a little bit about. We've been talking a lot of campaigns through the media and stuff, but I believe campaigns can happen through word of mouth as well. So, a lot of people who are here who will hear what we are saying will tell their friend, their mother, their uncle, whoever, and then word of mouth के through भी बहुत लोग एक दूसरे से connect होते हैं. So, मैं एक simple campaign आपको बताना चाहता हूँ जिसमें हमने $100 million raise किया है in cash and kind, and majority of that is in cash. And the entire thing happened through word of mouth. So the way it started was we had a few volunteers from prominent families who were going to municipal schools to teach math, science and English. They went to the schools and they said, यार यहाँ पे तो 300 लड़कियों के बीच में एक टॉयलेट है, डिश वॉशिंग ड्रिंकिंग हैंड वॉशिंग में एक ही नलका है, स्मार्ट क्लासरूम नहीं है, कैन यू डू समथिंग टू अपग्रेड द स्कूल्स? We said sure. And I can say it was Gautam Adani's son Jeet, and he said, why don't we do a program where we get maybe 50 other CEOs in the room. Let's invite them together and share the work that we have done to transform the impact, and improve the learning outcomes and the overall health by the work we've done in training the teachers and the children and the physical infrastructure. So that first event, because the right kind of people were there in the audience, they all said, okay, I can do 50 schools, I can do 20 schools, I can do 30 schools near my factory, I can do this in this state because that's where my operations are. And overnight it gave us a huge boost. Now when we were starting out, it was not thought ke bhai hum thousands of schools mein karenge. But the thought and the cause was very clear. Ke we want to help children improve their health and education. And now more than 100 companies are part of this initiative, including one of my friends, Oak North, who is also doing a lot of capacity building for our teams on ground. And now this is in 25 states in rural and urban parts of the country. So this has taken a face of its own. But the most important part we learned was to measure the impact of the work that's happening. And I think we were early on, cued into that, in, like Murthy ji said, God, I trust, everything else I need data. And the second campaign which evolved from the school transformation initiative is there were some brilliant students. A lot of these people would come to us, corporate employees or volunteering would come and say, क्या खाली राजा का बेटा राजा बनेगा? यहाँ पे धोबी के बच्चे मिलते हैं, रिक्शा वाले के बच्चे मिलते हैं, orphans मिलते हैं, rag pickers के बच्चे मिलते हैं, getting more than 80% in the 10th and 12th. Can we do something about this? Can we help them become doctors, lawyers, engineers, chartered accountants? Can we give them a scholarship? One such girl, Vaishnavi Panchal, Harshita, her right hand stopped working because of malnutrition in her 11th standard. And this girl was a topper in 10th. उसके पिताजी बड़ौदा में हीरे घिसने की छोटी सी कंपनी में काम करते थे. And she said, मेरे सामने दो ऑप्शन थे. या तो मैं मेरी पूरी लाइफ, I will just become a maid somewhere, drop out and become a maid, or I practice with my left hand. I keep writing ABCD, maybe 10 hours a day, improve my speed. She practiced. She didn't only did so good, she didn't only top in her 12th exam in her city, but in the entire state of Gujarat. She became a chartered accountant now, top 20 ranked chartered accountant in the country, passed in the first time, and she's working at Axis Mutual Funds right now in Bombay. So when this happened, and we made videos of some of these case studies and shared it on simply a simple WhatsApp broadcast. That's it. And I truly believe in the power of creating friends. We don't call them partners or fundraising, we call them friend raising.
Yeah.
Because if they are friends and you're creating impact, things will continue. They'll find ways to fit the work you're doing in what you're trying to do.
Absolutely.
And just by sharing those individual stories of children who are working at Goldman Sachs, Accenture, IBM, Google, who were earlier rack picking, that has inspired many more people to come forward. And these kids who are getting scholarships through their network have identified thousands of other students के इसके पिता भी धोबी है, इसके भी 90% आए हैं, and they've all uploaded. Thousands of people, children are waiting on our website to get support. So large scale campaigns can take place
Yeah.
and grow from places like this. Like I just found out, sir is my next door neighbor. So that could never be planned. That's a divine design.
Yeah. No, thank you so much. I think, Amitabh, you proved that communication is the key, right? And that, brings me to Winifred and Aishwarya. Again, I think both of you in your respective fields of sexual wellness and healthcare, how do you tackle these difficult conversations with so many different stakeholder groups and, communicating these with the cultural sensitivities? What are the strategies that have worked for you?
So, I guess I'll start with the storyline over here. एक कहानी है एक औरत की और सेक्सुअल हेल्थ और वेलनेस के स्पेस पर हम ज़्यादा बात करते नहीं हैं क्योंकि हम लोग औरत के बारे में बात कर रहे हैं शायद इसलिए 1.4 बिलियन पॉपुलेशन है और सेक्स की बात नहीं होती है शायद सिर्फ मर्दों के लिए ज़्यादा होती है तो हम बोलते हैं कि हम औरत के लिए बात करते हैं एक औरत है जिसका बच्चा हुआ था एंड 5 साल she was not indulged with her partner in any sexual activity just because postpartum depression से वो निकल रही थी but she didn't know. So in that case when she got to know about our brand where we are taking care of sexual health and pleasure both the aspects where all doctors sexologists gynecologists like therapists, they all come all together and help a female like navigate the challenges from 21 to 49 years of age. That's where she understood that she was suffering from this problem. And that's where we as a brand come in and we create the talk around this topic, number one, that we talk in the language of how India will understand about sexual health altogether. How women will understand. We don't talk to them in any slang words, etc. We talk to them in a way that, okay, हम कपड़े उतार कर नहीं, हम पहना कर बात कर रहे हैं बहुत gracefully and इज्जत के साथ. I guess that's what we do. Second, community के साथ में हमेशा अपने touch में रहना. उससे habit forming तो बढ़ता ही है, recall value साथ में बढ़ता है और word of mouth add on है. कि sexual wellness के बारे में बात हुई नहीं है पर हैबिट फॉर्मिंग कैसे करेंगे मैं एज अ फाउंडर 2 साल हो गए हैं बट आज भी अपने कस्टमर्स को आई गेस दिस विल बी माई प्रैक्टिस फॉर लाइफ दैट आई विल कॉल देम एंड आस्क देम आर यू ओके इफ यू आर नॉट ओके आई एम हियर टू फिक्स इट फॉर यू हैव यू लाइक्ड व्हाट यू बॉट फ्रॉम मी नो आई विल चेंज इट फॉर यू that kind of conversation when you do with your customers they be with you they talk about you right? And the third most important aspect and the last one is that we take care of education, awareness. If you see us as a brand, you will see that we're always talking about how to improve your sexual health rather than selling something to them.
Right.
I guess that has like really helped us and everyone in the team so far. Thank you.
Yeah, well, and similarly for us in healthcare, speaking about a cough or a cold could be very, very regular and normal. But imagine a country like ours, we've surpassed the US and China and we've become the diabetes capital of the world, 110 million people living with diabetes. And there is huge stigma even about insulin, right? अरे ये तो इंसुलिन लेता है शादी के लिए ठीक नहीं होगा or can he lead a normal life or like epilepsy I said people don't want to hire them or don't want to marry them so for us really also like Aishwarya awareness and bringing the voice of the person living with the condition we have people we are also in the area of rare diseases like we are in others and there is a rare disease called atopic dermatitis which most doctors also sort of disregard as khujli ठीक हो जाएगी भाई खुजली तो है but when the person living with it comes to the fore and speaks about it speaks about his or her small challenges you know or things that you and I feel are so easy to do remove a jacket and put it on the back of your chair but for the person living with atopic dermatitis removing a jacket means peeling a part of their skin so it's about putting their voice in the center and increasing manifold awareness and destigmatizing those health conditions is really the key. And our plea to all is also, a lot of organizations speak a lot about DE&I and somehow only zoom in on Pride Plus or ageism. But how about creating a safe space for somebody to inject insulin, or keeping diabetes free, or diabetes friendly food in your cafeteria, for instance, or keeping a separate room for somebody if they have an episode of an epileptic fit. So I think that really should be our definition of DE&I, because that truly is inclusive for all.
No, that's amazing. Thanks for bringing that up. I see we have just 5 minutes left, so I think we've talked about a lot of successes, things that have worked out. Varinder, Amitabh, and Puneet would love to understand from you what are certain initiatives and strategies that you took which didn't work out, and what do you think is an advice from you all for fellow marketers and different organizations to learn from these?
So, Harshita, one thing is very important. First of all, anything which you do in this society, it should have the buy-in of all your stakeholders and the partners. Normally, when you do a program, obviously there are many stakeholders who are involved. Many places it is the local government which is involved. Many places it is some of the NGOs which are involved. What we have seen is that unless and until your program is not well researched into, and if it is not well thought upon, and the end goal of the campaign is not visualized much in advance, always there will be a challenge. For example, in certain places, I'll give you a very, recent example. In Andhra Pradesh, in Kurnool district, we have one of the biggest tribal families of the country. Some of you may have heard of it. It's called the Chinchu tribes. Now, these people are very, very illiterate. They are very poor. And what happened that government, because of various reasons, I don't want to say, allotted them 250 acres of land. They said, this is your land. You are the owner of this land. Now, those farmers who do not even know speaking, writing, they were asked what to do with this land. Even though I have an acre of land in my name, I don't know what to do with it. So, ultimately this land became an arid land. It was totally, decapitated. There were no flora, fauna. It was just a dry land. Then somehow we got in touch with the local MPs and MLAs of that area, and we said, okay, let's come together as a partner, and we from Hyundai, we will work in making this land a valuable land for these people. So what we did, we owned that 250 acres of land. We started developing forests in those areas. There were 5 villages actually, 250 acres, 5 villages, 115 tribal families. And then we started planting some meaningful trees over there. And those trees were, if you all know, there is a very famous variety of mango in India called Banganpalli, which is typically from Hyderabad, Andhra Pradesh. So 25,000 mango trees, around 15,000 chiku, and the balance lemon trees were planted by us on that land. We taught the cultivation to those farmers. We brought what only thing which we got the support from government was the bore wells, because it was under their domain. So we created some bore wells. We started watering them. Now 3 years have passed. By next year, all these plantations will start bearing fruits. And now those 115 tribal families not only have learned the basic art of tilling, vegetation, they have also started doing something known as intercropping. So by the time these crops will start bearing fruits and they will start selling them for their livelihood and become a normal society people, they have also started selling those intercrops like pulses and dals, so that they can continue that livelihood from that place. So with this, that 250 acres of land is now a lush forest full of fruit trees. People are becoming more and more educated, aware. Society and the local people are coming to their support. They have also given them tractors as free of charge, so that they can continue this good habit. And from our side also, we have said that for next 5 years, we will maintain the land at a special way in terms of, so that they can continue to sustain by the time those trees really become big, tall, and continue to give those fruits forever. So what I want to say is that if government also would have thought of this program, then maybe for the first 2 years when that land was drying arid, that would have been saved, and those fruits have started bearing now only.
Amazing.
But I think that's where, as a learning, it comes from all of us, that your goals should be clear, Your stakeholder participation should be clear, and I think the vision of everyone should be what we call as progress for everyone. So
Thank
that's
you.
one example. Just I thought I'll give it to everyone over.
I can answer in 10 seconds and I'll hand over her for the last 10 seconds. Basically, Ratan Tata said that leaders don't make right decisions, they make their decisions right. So I think we have to learn, innovate, and make our decisions right. And for a more detailed answer, I'll post it on my LinkedIn account. I hope to see you guys there. Thank you.
That's the marketing we need.
No, but really, thanks a lot, first of all, for asking this question. Though I think both Amitabh and Puneet have done a bit of a googly here. But I just feel that as a sector, we don't talk about setbacks and lessons from, all the failures, or because I think everybody does have setbacks. We all learn from it. But thank you for asking, because we do talk about successes, but not so much about, what we've learned. I just want to throw back a quick question. I'll also take after that just 20 seconds. How many of you all have Instagram accounts? Okay, many. And how many have Facebook accounts now? So clearly, it's more Insta and less Facebook. And this is something that has changed over the last 3-4 years. Everybody would know about it. So, when you're thinking about communication, you are thinking of so many things, right? You're thinking of the content, you're thinking of the community needs, you're thinking of which platform to go to, who are the influencers you'll bring in. So one big setback, for example, for us about 3-4 years back when we were doing this campaign on social media primarily, and trying to change perception of Bangalore as a city towards waste pickers, was that suddenly Facebook's popularity started dropping within the young adults. And then, there goes your entire campaign strategy, which is based on the platform. Your influencers are based on the platform. So I think what really helped us get over that setback very quickly was analytics and measurement, something that we were continuously doing, and, then adapt to, this new platform where the campaign strategy was adapted. So I think keeping audiences at the heart of everything that you're doing is very, very important. And yeah, that's just one setback. I will also like to finish there.
Thank you so much. It was an amazing panel.